As a member of the Kansas Cancer Partnership, our HPV subcommittee planned the following events for Pittsburg, Kansas in the spring of 2016. We viewed the documentary Someone You Love, the HPV Epidemic, and we included a panel discussion that evening and a question and answer opportunity to speak with the physicians that were there on hand. And then we also opened it up to the public. And we followed that up with the next day we had a medical society meeting where healthcare professionals were able to hear Dr. Roy Jensen speak about HPV and the epidemic that we're facing right now. Well, as a member of the Kansas Cancer Partnership, we decided that because the rates in our area were so low for immunization that we wanted to change that, and hopefully by holding this event that it would bring some knowledge to people. I believe that it was part of the of the Kansas Cancer Partnership, what they had decided to do as a whole committee. We had partnerships and a planning committee. Our partnerships were members from the following areas, which was the Early Detection Works, Midwest Cancer Alliance, and the KU Area Health Education Center, Via Christi Hospital of Pittsburgh, the Community Health Center of Southeast Kansas, Pittsburg State University, the American Cancer Society, Kansas Comprehensive Cancer Program, and BeWise Immunize. I really wish we would have been able to bring on our local dentists. Unfortunately, at the time, it just wasn't an opportunity that they could help with. We started as the KCP, or the Kansas Cancer Partnership. We started in December of 2015. And then when we broke out to the Someone You Love subcommittee, we started that in January of 2016. Yes, it was plenty of time. We just had one committee that helped with getting the event to Pittsburg State, and that's where we had the event was held. So we all worked on that one specific thing together. Funding was generated through the Kansas Cancer Partnership Initiative, the Midwest Cancer Alliance, and we also were able to receive an in-kind gift from Pittsburg State University, and it was held at the Plaster Center on Pittsburg State's campus. We marketed it in several different ways. First, we established a target audience, and our target audience consisted of high school students, their parents or guardians, and college students pretty much under the age of 25. We developed a flyer. Once the flyer was done, we took it to local businesses. We marketed it to the PSU students, so every person who lived in the dorm received a flyer in their mailbox. We also sent letters out advertising it to sororities and fraternities. We put it on the PSU electronic billboards on campus, and then we also marketed the event at the Student Center, so it was in their calendar of events. We called the PSU newspaper, which is the Collegio, and asked them to advertise, as well as we sent it to student organizations that were healthcare related. Our local television station, which is KOAM, they filmed a commercial, which was about $150, and they turned it into a PSA. So it ran from the time that before the event started, and then the PSA was converted from the commercial, and then it ran to the end of the year of 2016. We also contacted the early morning show, and we also contacted the KKOW morning show, and were able to go on and talk about the event. We also sent letters to the Morning Sun asking them to advertise and inviting them to the event, as well as announcing the event. We also bought advertisement in the local newspaper, which is the Morning Sun. We contacted local billboards, electronic billboards in Pittsburgh, and for no fee, they can often advertise these kinds of events, so we're able to do that at no charge. And then we also sent it to the Crawford County school districts, and that included the junior high and high school, the board members, superintendents and principals, and also the counselors. Sure. Dr. Angela Shaw, who was Chief Medical Officer for Via Christi Hospital, and she's also an OBGYN. She was willing to go on and be our spokesperson champion, which really worked out well. We were surprised with some of the feedback that we received from the vaccine-resistant individuals. They were not very fair comments. A lot of them said that the vaccines were dangerous and that they were only harming children, which we have found not to be true. We didn't engage in them at all. That everybody's entitled to their fair opinion, and we just kept it at that. So it would have been nice if we had some information to follow up with them, the statistics, but I just didn't want to open that can of worms. We opened up the Plaster Center at 6:30 p.m. and the event was held from 7 to 9. It was around 25. It was a wide range of audience. We really wish that number was higher. Unfortunately, it was dead week at Pittsburg State University, so we feel like that really affected our total numbers. And dead week is the time during the year in the spring when students are finishing up with their spring projects and right before the week of finals, so we know that a lot of people were studying as well. Once the viewing of Someone You Love video was complete, we held a panel discussion where the audience was able to ask questions about the documentary. So it started with Dr. Angela Shaw. She was our spokesperson champion, an oncologist, a pediatrician, as well as an advanced practice nurse from Pittsburg State University. I feel like we were really missing a key member of the panel discussion, and that would have been a dentist. But again, we were unable to have them come because it didn't work out with their schedules. The morning show talent was able to moderate, and he did a really nice job, and also he didn't charge anything because he has children at this age, so this was really an interest to him as well. We looked online to see what some of the most commonly asked questions were about HPV, and we made copies of them and had a folder for each person on the panel. And so they were able to kind of look ahead and see if, and be up on the statistics for those maybe hard to answer questions. Like I said, the moderator was really good about coaxing questions. He had questions himself, so I felt like that made it easier for those who attended to ask maybe some more difficult questions. The following day at Via Christi Hospital in Pittsburgh, we had a Crawford-Cherokee County Medical Society meeting, and we decided to to have it focus on HPV, and we invited local dentists, area physicians, advanced practice nurses, and other allied healthcare professionals to attend this event. Dr. Roy Jensen from the KU Medical Center was able to come down and give this presentation on HPV. A lot of the people who attended the evening event didn't realize that boys could be immunized. So that was something that we found pretty interesting. And after we tracked that information on a pre and post test, so we were able to see at the end, when we worked on the evaluations, we were able to see that that was something that was pretty much across the board, that they didn't realize that boys could be immunized. We were really surprised with the safety of the vaccine, and which Dr. Shaw handled that in a really professional way to make those that are parents understand that it is okay to give to their children, that it is a cancer prevention. We did a pre and post test. The pre-test was to be taken before the viewing of Someone You Love video, and the post test was following. We were fortunate that MCA, the Midwest Cancer Alliance, was integral in writing the evaluation for us, so we felt like the questions were really well worded and easy to understand. We were really surprised again that most of the people who attended did not realize that boys could be immunized. And a lot of people were questioning the safety of the Gardasil shot. So we felt like that we had answered some questions that were sticking with. The common theme that we found in the continuing medical education event that we held the next day was that you should vaccinate earlier. Unfortunately, the vast majority of the attendees were some nursing students, and they were in their senior year, so they had left before we could follow up as they were graduating. So we did follow up almost a year later with another HPV continuing education offering, and by that time we felt like they were just had HPV education fatigue. So, and it was not well attended as the day after the Someone You Love video event was. Make sure you check your calendar and to see when students are going to be the most active. Unfortunately, like I said, we held ours during what was called Dead Week at our university, so it really hindered some of the attendance. Also, my words of wisdom would be to check out what is free in your community, how you can get the word out. Check your morning shows, your radio, with your local radio shows. They always hold a morning show where you can just request to be on as an attendee, and they will let you get your story out and talk about your event. It would have been nice to have a dentist and even an internal medicine physician sit on our planning committee. Maybe they could have given us some better ideas of audience to capture.